chief is going to tell us that there's a lot of people who have it that's not having any ill effect with, and they're just, you know, normal, probably true, normal. You would know better than us, you know.
I sat in on 3 breakers a day, 45 days. And the one that I found the most interesting was the medical examiner's brief.
We're now live on YouTube. So you guys know.
Okay.
Are you ready, Ryan?
Yeah, we're already live.
Okay, it's 6 o'clock. We'll go ahead and call the meeting to order. Mr. Buckley's here as a guest this evening. He won't be able to participate in the meeting, but first item will be roll call.
And Mr. Brown,
Here.
Mr. Fritz,
Present.
Mr. Gerke,
Here.
Mr. Layton,
Here.
Mr. Freeman.
Here.
Let's have Eric Dirk, US Chief, joined by video, CFO Jamie Luberin, joined by video, and Dr. Gustafson by video.
I'll take a motion to approve the agenda.
So moved.
Second.
All in favor, say aye.
Aye.
All opposed, same sign. Has everyone had a chance to look over the minutes from the previous meeting? If there are no additions or corrections, they'll stand approved as presented. Public comment.
We've not had anything come in today. I checked it about 20 minutes ago. And so nothing.
Okay, there's no comments, so we'll move on to the officers report, CFO report.
Hello, everyone. My report starts on page 5 with our sales tax receipts. So we had some good news that was up this month over previous years, about 40,000. So we are just a little under 1% under budget for this year. Any questions on any of that?
Yes.
Do you have any indication of why that might be?
Well, I looked and sales are up with a lot of groceries and that kind of thing. Those sales are up. And I didn't really look too close, but it didn't seem like restaurants and stuff were down that much either. Now this is for March, not April. So
Everybody was filling up refrigerators and freezers, huh? Goodness.
Thank you.
page 6 is the bank balances as of last Thursday. Up a little bit over the previous meeting. And then the cash reserve chart is as of the end of April. Page 7 is the cash reserve analysis, pretty much steady versus last meeting. Just a slight change there, about 3 days worth. Pages 8 through 10 are the check register. Anybody have any questions on that? Okay. I did want to let you guys know we did start the audit. Nick signed the engagement letter and the bank confirmation today, and they have the QuickBooks file so they can start working, and she's requested several items, and those I've gotten those to her, so hopefully we can get that done on time. I did sign the HHS terms and conditions on the first round of funding and applied for the second round of funding today. After April was over, we did some more calculations, and it looks like our runs, our transports are down for April. They were down about 85 transports. Eric will probably go through all that in his report, but based on our average billings, that's about $107,000 in lost revenue. And then we've so far got about $19,000 in expenses. So far about 126,000 of expenses due to COVID-19 for our organization. So I applied for the round 2 of those HHS funds today. I don't know if we will get anything or when, but we did go ahead and apply for that. Anybody have any questions on any of that? Okay. Back to my report on page 11 is the bills that are due currently. The summary, and the following pages are the detail. Anybody have any questions on any of those bills?
Mr. Chairman? Yes. Mrs. Lorraine, Insight Direct, CAD
Yes.
Unit 5 and 12. If I can pull the chief in on this, what units is Unit 5 and 12?
So 5 is the one we just got. 12 is the one we have on order.
Correct.
The new ones. Okay.
Correct, the new ones. Any other questions? After the bills, there is the credit card statement. Does anybody have any questions on any of those charges? All right, if not, that is the end of my report.
Jamie, if you could remind, Mr. Chairman, question for Jamie. Jamie, could you remind me when the remaining 55% is due on that contract on the generator?
So we paid 50% already. This is another
Right.
45%.
So this is, we just have 5% outstanding then?
After this, yeah. So we're waiting for the gas lines, as far as I know. Ryan might be able to answer that better.
So we need to-
Okay.
If there are no other questions, I take a motion to.
So moved.
All in favor, say aye. All opposed, same. Chief's report.
Okay. Not on mute here. Station 1 headquarters, basically the masonry, the bricks were put up in the remaining windows back there. That looks real nice. We've got it, I believe, all but painted. As you know, the generator's in place, and we're just waiting some bollard pole installations. Mr. Fritz has been so kind as to help me out on some of that, so he may have some information on that. I don't know if you want to jump in here and do anything, John, or just wait until
We'll
later.
wait till the end of your report if that's, so I won't interrupt you, sir.
Okay, thank you.
I think we haven't actually have an item on unfinished business, so we'll just do it there.
Oh, okay. All right. You're right. You're correct. For now, we've just got a cone marking it out there, but nobody's getting close to it. It's safe so far. No issues. I don't expect any. No work's done. No work's being done at Station 2 or 5. Those are both holding up, even with all the rain. No issues with flooding or anything. So that's good to know. We have, for operations and staffing, we don't have any work loss due to COVID as of 07 May. We did have one family member who had on the advice, I think I covered this last board meeting, but on the advice of the health department, go home for a shift or two because he had a very sick family member that was awaiting tests. But nobody's came down with anything at the district, so that's good. We want to keep it that way. We've got one EMT out on FMLA for 12 weeks. I can't get into the reasons there, but they're going to be gone for a while. I do anticipate they'll be back at the end of that 12 weeks though, without any issues. You can see these numbers change. This came out, I believe, this was as of the 7th of May. We are up to 68 cases in the county. We have had our first death in that county. I believe Joanne Martin's put some information out on that. Calls are still being screened, of course, through dispatch for this disease. Our crews continue to respond with all the appropriate PE. I'd like to have more gowns, but you get what you got. So April call volume, if you want to flip to page 19 and 20 there. 20, I just went ahead and printed out for historical reference. Jamie had alluded to that decrease in call volume. As you can see, April of this year's total call volume was 557 compared to last year's 574. It's not a huge difference, but if you go down to transfers, you can see where we're taking that hit. Bothwell is on low census right now. As some of you might already be aware, so they're really just not shipping out the patients they normally would be shipping out. I don't think that's going to stay that way. I believe that's going to be going back up here fairly soon. I know they're getting some more traffic. I'm not sure if their census has went up hospital wide yet, but I know they're doing a little better as far as opening up some procedures. So hopefully they've been taking some pretty heavy losses over there. So hopefully that gets better for them real soon as well. The call volume, like I said, non-transports 212, bringing us to 557 for April. Total transports of 345 out of that. And like I said, you can see there was only 91 transfers out of Bothwell. We did have two scene flights, or two flights from the LZs rather. About on par for canceled calls, actually not quite as many. Invalids a little high. No care needed. Again, it's springtime. We do get a few car wrecks, although that's ebbed off a lot too with some of the decrease in traffic. If you can believe that, it's actually been fairly busy in Sedalia, it seems, but that's purely anecdotal. I don't know if we're getting more or less traffic. It just seems pretty busy for being locked down. Not really any standby events because we're just not really doing much right now. Those are, I believe those three are fire standbys. So our total non-transports was up a little bit, 212. Like I said, the major percentage-wise offset this month, I believe, was the transfers hit we took. Only 3 status level 0 events. No issues were caused by those. They were all pretty short events. And our year-to-date call volume for the year-to-date call volume for last year was 2308, and we're at 2537 this year. So we're still, it's still on the increase. Not as much as I would normally see this time of the year. We'd be seeing a 4 to 6% increase where we're just kind of remaining steady there. So, but no huge dents. Windsor down below on page 19, total call volume 96, staying right on par there. Last year we were at 106, so we're down 10 calls, not too bad. Transfers were actually up from Bothwell, and not too bad out of Golden Valley, still getting a fair share of our transfers out of there. 911 calls were down quite a bit. I can't speculate as to why that is necessarily. I think, one flight out of Windsor district, and our year to date was 371 last year. And we are oddly, I had to check this 3 times because I just didn't believe it, but sure enough, at the end of April, we were at 371 last year. So right on par there. Back to page 18. Again, we've got 68 cases in the county. I checked the map on that. I believe that's current with Joanne's numbers today. The 2019, education, skip down to number 3. We did start our EMT class last night. We ended up with 13 students who did a really good job maintaining social distancing. Justin had them out with a yards or a tape measure, had them all spread out very nicely. And one of the reasons we're able to do that class is via Department of Health and Senior Services waiver that allows us to keep going with those classes as we are an essential service. And we do need to keep turning out new EMTs and new paramedics across the state. So, so far, so good with that class. hopefully, when we get into the closer hands-on aspect of this course, where we're going to need to be a little bit closer than that social distancing, some of this will be on the downward trend of this. So we've got our fingers crossed there. If not, we'll have to find a way to do it virtually and figure out fit, form, and function once again. But so far, so good. And those classes are Mondays and Thursday nights from 6 to 10 p.m., by the way. Let's see. Supplies. We're still short on gowns. Everybody's short on gowns. There's people making them out of drapes, surgical drapes. There's people making them out of cloth. The whole nation's going and really pitching in and trying to help out as much as they can with our first frontline first responders and so forth. Our supply officer, I wanted to give her a shout out. I don't know if she's listening in tonight on YouTube or not. Sharice Bauer, she's doing an excellent job tracking down these supplies for the district. It's a never ending gig right now for the daily job she's doing, as well as working very closely with our infection control officer, Jacob Wade. So I wanted to give both of them some credit during this meeting tonight. I also really want to thank our local companies, community members, organizations, churches, individuals who are helping out by providing our much needed masks and face shields for frontline healthcare workers and first responders. Optimally, we'd have the store-bought nice high filtration models, but the fact is just as the CDC has said, something's better than nothing, and it does at least slow things down, even though at the end of the day, those viral microns are very small in size and able to go through a lot. But those masks do help protect some of the PPE that we're recycling, as well as the general public using them does at least slow things down a bit. It's not perfect. It's never going to be perfect, but we really, really do appreciate all those people pitching in and doing their part to keep us safe out there. Don't have any new vehicle information at the time. Mr. Meehan, I think that was you that asked that question. That receipt for that money, it said one, but that was actually 2 computer systems for that truck. So I had to do a double take on that one just in case you looked at the details. There is one local company actually here in town that switched over some tooling. That's Zephyr. I believe they make brooms on a normal day, and they've been making some N95 masks. I don't think we've got any of them in yet, but I definitely wanted to give a thank you to them as well tonight. Other than that, gentlemen, I don't have any other information. We're just still trying to keep on top of all this. Things are changing on a daily basis, and so far, I'm really happy to report to y'all that, like I said, nobody's been harmed by this at PCAD. Crews are doing a really good job keeping vigilant despite what's called preparation fatigue. Often this times in an epidemic or a pandemic, you'll see people get a little lax with wearing their personal protective equipment. We've been doing a really good job with that. So thank you to the crews for that. And that's all I got.
Are there any questions?
Yeah. Chief, with regard to your comment about the gowns,
Yes, sir.
Is there anything this board can do to assist you in a false perception that everything is in place for everyone, when in fact it's not for us? What can we do about the gown situation?
Well, I don't think there really is anything, and admittedly, it's hard to decipher in an election year. You get a lot of political points made along with facts, and it's hard to discern between the two right now. But the bottom line is that it does remain a problem. I do appreciate that. I don't think there's anything the board can do. It's just a matter of catching up with need. Something like this goes through what we did have on supply very, very quickly. I mean, there's no doubt about it. Nobody could have been fully prepared for this. I think overall, right now, things are going in the right direction. There are some services reporting full supplies on PPE, which we are, except for that. Bothwell did help us out with some disposable gowns they have. So we try and use those only on our very highly suspected or known COVID patients, which we have transported a few of those. So we have went through our share of PPE on those. I don't think there's anything the board though, is going to be able to do to make that situation any better. Other than, like I say, there's people in our community, there's sewing cloth gowns. The only thing we've been able to find, and this is searching high and low, the only thing we've been able to find ended up having some latex in it, which we've got some people around town that with severe latex allergies, so we won't be using any of that. So we're holding out for hopefully the good stuff will eventually start flowing in here, and I'll keep the board apprised of that. But I do appreciate you asking.
All right, thank you, Chief. That's all I have, Mr. Chairman.
Follow up, Chief, on your education piece there. How long is that course?
I don't know if Justin's in here tonight, but I believe last time we talked about it, it's a total of 160 hours, so it'll be about 20 weeks.
20 weeks.
Those are, 8 hours a week for 20 weeks. And that'll give you 160 hours total. Plus, they're going to do, of course, some clinical time on top of that. And that DHSS waiver allowed schools across the state to do that. So what that means is we've got a few of our EMT students who are in paramedic classes across the state, and we're actually going to bring our employees, just our employees, back in so that they can finish their clinicals and help out our service. We won't be taking students in that don't work at PCAD, but we're definitely going to get our people through there, and that's going to help them out tremendously and work a lot better than any virtual teaching or virtual clinical rotations will do for them. So yeah, it's a great question, and I'm happy to say I know they're happy to get back in the saddle and continue on their clinicals. A lot of them are, several of them are really close to being done, so this couldn't have happened at a worse time. So it's good to get them back in and doing clinical rotation.
Any other questions? Thank you, Chief. Medical Director.
Well, I really don't have anything specific tonight. It's been a little crazy, as Mr. Dirk has explained. The one question I have for you, Eric, are there any plans on opening up or easing the restrictions on the quarantine there in Pettis County?
I can't speak for the entire task force right now. As it stands, the initial plan was to wait until we see a decrease in cases before we start really opening things up. However, I know Mayor Katie has opened a few things up. By and large, it's went pretty well. I think we've had some problem areas with people not following the social distancing guidelines, which, even though we're opening up, are still a major part of the recommendation. So that, even though we're opening up, I want to point out, as you well know, that social distancing, mask wearing is still highly recommended, if not required in some areas. I don't think they're required here, but they're certainly highly recommended. And until we see a marked decrease in cases, I don't think the health department's going to be able to ease up a whole lot. But I know there are some places that are opening back up. So we'll call it a phased response, but it's not completely back open.
Right. One thing we're seeing around here, there's, as you mentioned with Bothwell, the hospitals and some of the clinics are expanding their services. But in terms of restaurants and bars and things, they're trying to do a controlled opening and not have just a widespread floodgate that's going to cause us to see a sharp spike in cases. So hopefully we can avoid that and keep everybody safe and healthy.
Yeah, after our task force meeting, two of the health department's major concerns were, one, we just got over Mother's Day, and it's pretty hard to keep people away from their mothers on Mother's Day. So that caused some gatherings to occur. And also, we're coming up on another holiday, coming up on the holiday weekend at the end of the month. So we'll see how that goes.
Okay. Do any of the board members have any specific questions for me?
Can you, if I might, I have a question if I can jump in.
Sure.
Can you hear me okay?
Yes.
Can you
Yes.
speak? Okay, Doc, can you speak a little bit about testing? I know I've been asked about this by a board member here and there, and it's not really in my wheelhouse. So if you wouldn't mind, if you could enlighten us maybe on some of this antibody testing we're hearing about.
It's really pretty spotty. You know, I really don't know specifically what the plans there are, like for individual counties, you know, outside of like, you know, St. Louis and Jackson and Greene counties and whatever county Columbia is in. I don't know how, I haven't seen anything in writing how pervasive the testing is going to, the antibody testing is going to be. And there's question about, as usual, who's going to pay for it. I've seen some information filtering out that there's some people want the private sector to pay for the antibody testing, and there's others who say, you know, we really won't have any good numbers if we don't do widespread testing and have it funded up front so that we can get accurate data. I know that's doesn't help you much, but it's a mess. It still is a mess.
Okay. Anything different? Have you heard anything from Mark on first responders being tested?
Not specifically.
Okay.
There's a lot of interest in seeing if around the state, we've been pretty lucky in terms of not having a big workforce reduction due to COVID illness. But there still is a lot of interest in finding out, have there been asymptomatic cases? Do our EMTs and medics have antibodies from their, you know, limited exposures? But as far as widespread testing, I don't know.
Okay. I can share that there are cases all throughout the county. Initially, we were seeing them in pretty definable clusters. And again, the health department was doing a really amazing job, kind of around the clock job, trying to track all those contacts. But what we're finding out now is it's not discriminating. It is at all four corners of the county, as well as in the city. So there's not really any rhyme or reason to it, the newest cases. Some of them are illnesses, people that would have been coming off quarantine and are still showing symptoms, so they're extending their quarantines out. But the other ones are most certainly community acquired and probably from going places they are not supposed to be going.
Or not taking appropriate precautions.
Correct.
Have your nursing homes been spared?
To my knowledge, I know we had one. Don't know if I can say legally which one. Probably shouldn't. But to their credit, they didn't know about it either. And when they did find out about it, they were very preemptive in getting PPE on that patient, so that our crews only had a very low risk exposure, and that's been more than 14 days ago. So no, that's one of the things that we can be very proud of in Pettis County was getting on top of the health department, getting on top of the nursing homes themselves, getting on top of shutting themselves down and really tightening things up. That made a huge difference here, because I have not heard of any spread in the nursing homes of any significance or at all for that matter.
Good. Okay. Well, I really don't have anything else for the board, so you can continue on there.
Thank you, Doctor.
Thank you.
Reports from committees.
The Strategic Planning Committee hasn't had any meetings with the COVID-19. We'll move on to unfinished business. Approve the emergency sick leave provision.
So we had the attorney draw up a revised memorandum, and that's on page 21 is where that starts. So on page 22, towards the bottom there, after section 2 is the parts he added.
Are there any questions on that? If there are no questions, I take a motion to approve that emergency sick leave.
So moved.
Do we have a second?
Second.
In favor, say aye.
Aye.
All opposed, same sign. Collections bid open.
So we got 3 bids from the new billing company, EMS MC, and I went through those bids. I'm waiting on references for each of them. So I really don't have a recommendation. I sent those all out to the board as well for you guys to review if you so choose. All of these 3, the fees are much less than what we've been paying and what we've had in other bids. The first one we got was Bull City, and theirs is 18% of collections. And then there's a Data Max, which is 22% fee, and an SCA, which is a 24% fee. So like I said, I'm waiting on the references on those, and they're all EMS agencies, so there might be some time involved in that. Any other questions on those?
When did you send those out? Just
This afternoon, and they went to your new email addresses. And it's a link, but it came from my email.
Are there any other questions? No, we'll just table that till the next meeting and she can have a recommendation for us. Ballard pole and rail installation update. Mr. Fritz, do you have something?
Yes, thank you, Mr. Chairman. Chief Dirk asked me to assist him in this thing that was on his plate. And that's the bollards that we've been discussing installing over here at the headquarters building. We all were familiar with the advanced fence and rail bid, the only bid that we got back. Since that bid, we decided to pull back the number of installed bollards that we want to do over there. And the chief and I have talked, as well as the entity bidding this has indicated to me that he's ready to start anytime once we give an approval. His breakdown would be the simple total of his estimate divided by the number of bollards that he bid, and that came out to $344 approximately a bollard. He said he would install 10 bollards at that price. So I asked that the board consider that bid, and this guy's ready to start right away. We got to get these things up and protecting our building over there, especially the generator. So that would be the amount of $3,440 for 10 bollards. He's ready to start right away. advanced fence and rail.
Are there any questions for Mr. Fritz? I would take a motion to approve the installation of those bollards.
I'll make that motion.
Second. All in favor, say aye.
Aye.
All opposed? New business. And so we'll move on to announcements. Does anyone have any announcements? If not, I would take a motion to adjourn the meeting. Make a motion to adjourn.
Second.
All in favor, say aye.
Aye.